Welcome to Your Body, Mind, and Spirit, the podcast where we explore the connections between health, wellness, personal growth, and spiritual transformation. Brought to you by Your Journey to a Better You. Start your journey to removing blocks and habits that are keeping you from living your best life today at yourjourneytoabetteryou.com.
Hi, welcome to the first official episode of Your Body, Mind, and Spirit, an information source to help you bring health and balance into your life. I'm your host, Linda Harkcom. I'm a professional journalist and healer who interviews experts in their fields about everything you need to know about your body, your mind, and your spiritual path. From everything like how your genetics influence your health to how to communicate with your angels. I plan to cover it all. We are here today with Dr. Viola Agostino-Valletta. Dr. Valletta is a chiropractor, natural health care provider, educator, and holistic wellness advocate with more than 35 years of private practice experience. As the owner of Chiropractic Lifestyle Solutions for Families, she helps adults and children improve their health through individualized, results-based care that blends chiropractic physical medicine, functional medicine, postural neurology, and clinical bionutrition. Her education includes a Bachelor of Science in Human Biology and a Doctorate of Chiropractic from the National University of Health Sciences, with postgraduate training in orthopedics, neurology, and nutrition. She is certified in functional disconnection syndromes, childhood development disorders, manipulation under anesthesia, and is a national certified NRCME medical examiner. Thank you very much for coming, Viola. Really appreciate it.
You're welcome. I'm glad to be here.
And today, full disclosure, Dr. Viola is my whole family's chiropractor, as well as a close friend of the family. So we trust her with our health. You should trust her with yours as well.
Thank you, Linda.
So one of the things we are going to talk about today is gluten and gluten sensitivity versus allergy versus celiac disease. That's a very personal issue to both Viola and I. I personally have celiac disease. As does my daughter and my son. So we are living with that, and we understand that, we've been there. We've like celiac disease. What the heck is that? To fully living it. And so what we want to do is help you understand the differences and, some of the symptoms to look out for and testing and so forth. And there's so much information about this subject. We're probably going to do a series on this. So this will be the first of that. So Viola, let's start with the simple question is, what exactly is gluten?
So gluten is the protein in certain wheat and in certain grains. So it's the protein portion of the food. And it's the thing, protein is what your body will react to if it is not absorbed well through your gut.
Okay.
So when someone with celiac disease gets the protein, the gluten protein, whether it's in a bread or it's in some sort of seasoning, it will come through and cause an inflammatory reaction in their GI tract, in their gastrointestinal tract.
Okay. So many people use these terms kind of interchangeably: gluten sensitivity, gluten allergy, celiac disease. Can you explain the differences between, let's start with the gluten sensitivity, which I think you said is being diagnosed as, or has a different term now.
So there's celiac, which is classified as an autoimmune disease.
Okay.
Because of the reaction that the GI tract has to the gluten. There is non-celiac gluten sensitivity, which is right now not classified by the powers to be. The NIH doesn't consider it an autoimmune disease, though some of us in practice may have some questions about that. So there's gluten sensitivity that is non-celiac, and there's gluten sensitivity that is celiac.
Okay.
You can also have skin reactions to gluten, something called dermatitis hyper something. Oh boy. And you can have gluten ataxia, which is where the gluten affects the brain. So the gluten can affect the stomach and the GI tract. It can affect the skin, and it can affect the brain, depending on which of these sensitivities that you might have. So generally, those are the four areas, the four diagnoses that are related to people who don't do well with gluten.
Okay.
And some of them overlap. So sometimes you can have celiac and dermatitis and ataxia, and you can have non-celiac gluten sensitivity and dermatitis and ataxia, or you could have one or other. So there's often overlap between all of them.
Okay, great. Thank you very much for explaining that. Now, which of these is the most serious medically?
So from a standard medical view, celiac is the most serious because it is a proven autoimmune reaction that will, over time, wear down those tissues and cause long-term devastating illness to the GI tract. That they know for sure. How serious the other things are still up for debate. The people in the functional medicine world, like myself, will tell you that they can be as devastating, if not more devastating, to someone's day-to-day life than celiac. There are a percentage of people with celiac who don't even know they have celiac and don't have any symptoms, and just live their lives without any sort of issue. That's a whole spectrum, the whole way to people who are fully disabled from their celiac. And in my practice, in what I've seen in my years, I've seen all four of those diagnostic presentations do the same thing. So people who had non-celiac gluten sensitivity that really wasn't bothered by it in their everyday life, to people who were disabled by it. And same thing with gluten ataxia, and the dermatitis can be devastating. So all of the treatment for all of those things is removing gluten from your diet. And that's also one of the ways that the non-autoimmune diagnoses are diagnosed. So non-celiac gluten sensitivity is generally diagnosed by removing gluten and seeing how you feel.
Okay, great.
Whereas
thank you.
Celiac is a little more intensive.
Yeah. Well, and I know with celiac disease, there's there's a chance for the damage to cause done by the gluten to cause cancer. Is that also true with some of the other, or
again
is that something that's still unknown?
I think it's still unknown. Okay. I think that there's just not the fact that they've even created a non-celiac gluten sensitivity diagnosis is relatively new in my 35 years. So there hasn't been a whole lot of research done to see exactly. There's some research that says that people who have non-celiac gluten sensitivity will often also have the same genetic factors, the same autoimmune issues, very relevant anecdotal tales of how they feel and how they function. But there hasn't been a whole lot of research into it to see what the long-term effects are. So it's hard to say. It really is hard to say. I mean, we know for sure what will happen with celiac.
Yeah.
We know for sure that if you eat gluten, you will cause chronic inflammation, which will eventually lead to a cancer. And that's common.
Well, and I think it's really important for people to understand that, understand that because, and especially for those that, we don't know what's going on with some of the other diagnoses because, it's not like and there are people that choose not to eat gluten for their health because, for whatever, it's a diet choice. But
Right.
those who are choosing it because of, it does damage to their body in some way, shape, or form, including the possibility of cancer. It's not like there's a choice. And it's not like, oh, I'm going to have that. It's going to give me a tummy ache and I'll deal with it. Like it's, you have to really think long term and what the damage is. And it's so much more than a tummy ache for a lot of people. And
Right.
so I think that's really important that,
And that's true for non-celiac gluten sensitivity as well. I mean, it truly is a spectrum. I mean, there are some people who are like, oh, I don't eat gluten because I'll get a little indigestion or I'll get some heartburn.
Right.
The whole spectrum to people like me who are non-gluten sensitive, but if I eat it, I will be sick for days. I will lose work. I will be very ill. And a lot of times people end up not getting their celiac diagnosis because they don't want to do the testing, because you have to eat gluten to do the testing. Yes. And anyone who has lived through being glutened, as we say, anyone that's lived through that and it's made them very ill does not want to eat gluten for a set amount of time and then get tested to make sure it's celiac, because when you get that sick, you just give it up. It doesn't really matter what anybody calls it.
Right. Exactly. Yeah, no, I 100% agree. And I think that's a really great point that you brought up, because a lot of people do not know that they have to be eating gluten to get tested. And the number of people that I know that say, oh, I have problems, but they tested me for celiac and I tested negative. I asked them, well, were you eating gluten leading up to the test? Well, no. Well, can you explain why, so people understand why you have to eat gluten for let's talk about the blood test, not necessarily the whole GI scope thing, but let's just talk about the simple blood tests where they're looking for the markers.
So there are markers that are activated from your immune system, and they are reactive to you eating gluten. So when you eat gluten, you will produce these particular immune cells that then can be tested by a blood test. They can also be tested by doing immune panels, all different reactions. So even someone with non-gluten sensitivity can also be tested for different responses. But again, they have to be eating gluten. So your body takes that in, that protein gets absorbed through your gut. It gets into your bloodstream because your body can't break it down correctly. Mm-hmm. So it gets in as a protein instead of an amino acid. And then your body sees it as foreign protein. Same thing it sees as viruses and bacteria are foreign protein. It creates a response, making more immune cells to fight those off. And so they send these fighter cells to the area where the gluten is. So in someone with celiac, pure celiac, that immune response happens in the gut. And so what you have are your body attacking your own tissue. That's the autoimmune part. So that reaction to the gluten causes your body to attack itself in the area of the gut in people with celiac. people with non-celiac can get attacked in different areas. So there are lots of different places that your body can get confused and send those fighter tissues to fight off what they think is a foreign object. And it can be a whole lot of different areas. The gluten ataxia is where the gluten will attack the cerebellum of the brain. So that's how you get the gluten ataxia.
Oh, okay. I did not know that.
Yeah. So there are different ways. There are people who get thyroid reactions. So gluten can cause your body to suddenly create immune system cells that fight off something that looks like thyroid hormone that's one of the reasons that there's, a lot of discussion about whether non-gluten sensitivity is autoimmune or not. The path is clear with celiac. It is clearly this happens and then this happens and this is where it happens. Right. And then we can go in, we can do the blood tests. GI can go in and they can actually test the tissue in the GI tract. They can look for the percentage of cilia that are destroyed by the gluten or by that reaction. So there are lots of ways to definitively diagnose, but you have to be eating gluten. And you have to have some damage there already by the time they diagnose it.
Okay. Yeah, that was the next question I was going to ask is like, if you weren't eating gluten and they did the biopsy type test, can you get a false negative for that as well?
You can, yes. But it depends on how much damage has been done, how much gluten you ate, how long it's been. I mean, for some people, the damage is permanent and then they stop eating gluten, but there's nothing you can do to bring it back. For other people, it's, they're just starting to get some of the symptoms. They're just starting to get some of the tissue damage. And so you can still see it. So generally, to get a positive diagnosis, you have to have damage. So you have to already have damaged tissue. Okay. That's the definitive diagnosis, is the positive blood test and the damaged tissue in the small intestine.
And I know some doctors are not requiring the patient to go through the biopsy type test.
That's relatively new. It used to be that was the gold standard. That was really the only way that you knew. Mm-hmm. I think now that they've added non-celiac gluten sensitivity as a diagnosis, and it's much more recognized as a diagnosis, I think that they're a lot less likely to put people through the biopsy, knowing that the treatment is the same. And generally the outcome is the same. If you're that ill and your body is not doing well with gluten, you shouldn't eat gluten. So I think that a lot of doctors have just said, we don't need this last step. But it used to be that was the only way. So.
Yeah. And I think that's really awesome that the doctors are doing that now. They're just saying, no, what the markers on the blood tests clearly show there's an issue. Right. We're not going to, put you through that extra expense and pain and prep and trouble to do that. And I know within the gluten community, there's some question about that. A number of the groups that I belong to, people will come on and say, I tested positive. Do I have to go get this? And, my doctor says I don't have to. So,
right. Well, I think the place that they make you get it, and is my understanding from patients who have been through this different paths, is that if you are applying for disability, or if you are disabled by your celiac, they require much more proof of celiac than they do for other things.
Gotcha. So that makes sense.
I actually have a patient right now that has been gluten-free for 15 years. She was a very ill young woman, cut out gluten has been perfectly fine since she cut out gluten, gets very sick if she eats it, but they won't give her an official diagnosis because she won't go through the testing.
That's so crazy.
She's just not going to do it. So
yeah,
it's okay.
Yeah. Oh my goodness. So what I'm hearing, I think, other than is that a lot of the symptoms are the same across all these different, except for like the skin, but like as far as the sensitivity or the allergy or the celiac disease, and I know I'm not using the correct terms there, but all across all of these, the symptoms are relatively the same depending on the person.
Yeah.
Right?
So GI symptoms are very much the same. They just vary in degree.
Okay.
So, and again, regardless of whether it's celiac or non-celiac gluten sensitivity, some people's GI symptoms are a stomach ache or indigestion. And some people's are full-blown, vomiting and diarrhea and fever and, really ending up quite ill physically, almost like being poisoned. If anyone out there has ever had food poisoning, it's a whole different thing than just having the stomach flu. It's very much, it can go as far as that to that gluten can be seen almost as a poison in your body. So,
well, and let's talk about some of the non-GI symptoms. We touched a little bit on some of those, but like I know personally, had my daughter not been diagnosed with celiac disease, I would never have gotten tested because I didn't really have GI issues. Mm-hmm. But the way it affected me was I had, muscle and joint pain. And I had just had inflammation all throughout my body. I would get out of bed in the morning and just everything would hurt. And I just thought it was part of getting old. And when, she told me, she said, Mom, it's not just digestive issues. It can affect those things too. Well, I got tested. I was actually surprised that I tested positive.
Right.
But since I've been gluten-free for 2 years now, except getting occasionally glutened, and not on purpose, never on purpose. But I get out of bed in the morning and I don't hurt. Like I bounce out of, I'm full disclosure, people, I'm 59. I bounce out of bed in the morning and I don't hurt anymore. And I really had been on I thought I was on the same path as my mother and my grandmother and my aunts, who had all had horrible arthritis to the point where, my mom has been bedridden for years now. She will not get tested because she doesn't want to stop eating gluten at 82. But, hey, what am I going to do at that point? Right. But, it's amazing to me, the difference in my body. I also, I know I get brain fog. I know my son gets the brain fog really bad. Mm-hmm. So all three of us genetically have celiac disease. My son and my son's symptoms are different than my daughter's. My daughter's symptoms are different from myself, both of them. So some of the symptoms, Ben and I both have the brain fog. But other than that, that's the only symptoms we have that are the same. So it's really interesting that, even within a family, you can have people that have the disease, but they react physically differently each to when they have gluten.
Well, that's absolutely true. So there's some pending research. They're just starting to look at celiac and non-celiac gluten sensitivities and idiopathic muscle pain, idiopathic joint pain. And they're trying to see what the correlation is, because anecdotally, those of us who treat pain patients very often see that diet has a lot to do with pain and the chronicity of the pain, the way it affects life, whether it's joint or muscle. And I have seen that many times where a patient figures out that their pain in their body was related to something they were eating that didn't agree with them, whether it was a sensitivity to gluten or dairy or nuts or many other things. What you'll find is that autoimmune diseases like to cluster. So if you have one autoimmune disease, you tend to have others. We don't always look for every one of them and name every one of them in a patient. But if you have an overreaction, which is what an allergy or an autoimmune disease is, an overreaction of the immune system to one thing, you are more likely to have it to other things as well. And generally that has to do with genetic markers that you can look for that are the same. So my guess is that if we did the genetics in your family, you would all come up with the same genes turned the same way. And the number of those clicked in the wrong direction, or the sequencing of them may be a little different for each of you, but it will all be the same gene pools. That particular gene in you is affected, and affected for your son and for your daughter in different ways. And some of it has to do with presentation, with lifestyle. Those are very much the way that those genetic things will present themselves. So you have that genetic predisposition, something in your lifestyle kicks that gene either on or off, telling it to either express itself in a good way or in a bad way. And then you have some sort of symptomatology. And, lifestyle is different for all of us. So depending on what that lifestyle is, and things like age and how long that lifestyle has been going on, and it really just depends. We can hope for our kids' sake that knowing when they're younger will allow them to make those lifestyle choices that they need to make them healthier, and so that they don't get to be older women like us who are finding all of these things that we can't eat or we can't do, or dealing with joint pain or any of those things. So that's our goal, right? Make sure that the young people find out early enough so that they can make those lifestyle changes.
Right. Absolutely. Absolutely. And wow. And then speaking of genetics, I think right after I got diagnosed, or right before, I had read a statistic that says something like 1 in 10 people with Celtic heritage have the celiac gene. Oh. And so that's a lot of people. That's a lot of people. And let's talk about that. Like, you can have the gene, but it doesn't kick in until something happens in your life. Even maybe a big stressful event, something like that can kick it in. But you could have it, but have no symptoms. You wouldn't test positive because you wouldn't be reacting. But that is something that, so it is something you have to kind of keep, not necessarily keep an eye on, but not think, oh, well, realize that it can happen at any point in your life that can kick in if you have that gene.
Well, the way I explain genetic expression to the patients is that it's like a barcode. So your genes are like a barcode. Like, you go to the grocery store and it gets scanned.
Yeah.
Okay. If your lifestyle is positive and you are doing things that decrease your chances of a certain disease or disease process, it's like covering your hand over that scanner. okay, like over that barcode so that it doesn't get expressed.
Mm-hmm.
And when you're doing things that are a negative effect on that part of your health, that's when it gets scanned and it shows itself. So we all have those barcodes. It's just a matter of how we can save those from being expressed. And our lifestyle is what expresses them, either for the good or for the bad.
Right. I want to look here and see what we have and have not covered that we had talked about today. We talked about the diagnosis and testing. I think, well, one of the things I also want to mention is, I know fibromyalgia. A lot of people are diagnosed with fibromyalgia. And I think, correct me if I'm wrong, I feel like that can be a diagnosis that means at times we don't know what the hell's wrong with you, but we know you're in pain, right?
Mm-hmm.
I know that I have a cousin who has fibromyalgia, and her doctor actually told her to not eat gluten because it will help reduce the inflammation that she has. Are there other people that have other diagnoses that should consider avoiding gluten because it'll help? I think I've read some research with even autism that there's some.
So there are a lot of different conditions that mostly inflammatory based conditions or conditions related to autoimmune issues that will where it's recommended that they stay away from gluten, stay away from dairy, stay away from soy, certain things that we know can be inflammatory. Part of that reason is that, we can anecdotally see that they do better. There's less inflammation. When it comes to brain issues, and there's some question as to whether fibromyalgia is a muscle issue or a brain issue.
That's interesting. I didn't know that.
When it comes to brain issues like autism and neurodevelopmental issues, even ADHD, again, that gluten ataxia, which is a diagnosis, means that gluten is affecting the brain. Gotcha. And so it can affect all different parts of the brain. They only list one, but it can affect all different kinds. There's also the thought process from a lot of people is that the gluten in the United States, the gluten that you and I encounter, is poisoned with pesticides, and that it's actually the pesticides that cause those reactions, those inflammatory reactions.
Oh, okay.
So I'm sure if you've talked to anyone who's traveled to Europe, they have said, I went to Europe, I could eat gluten, I didn't get sick. Right. There's a different process in other countries in the way they process their foods, the way they grow their wheat. It ends up with a different chemical combination. And for a lot of people, there's no effect on them. In that case, that would be a non-celiac gluten sensitivity, obviously. Right. But yeah, so there's some pretty good evidence that, there's some Roundup in just about all of the gluten that you eat. If you eat it, which we all know, even from lawsuits, is not good for us. Right. So, so I think there are lots of people who, even the typical standard GI doctors, not natural doctors, not functional medicine doctors, just your basic GI specialist, will tell the patients who have any sort of irritable bowel symptoms to stay away from gluten. It's not uncommon for them that to also be the case with some of the neurologists that are dealing with people with multiple symptoms, multiple neurologic symptoms. They will try to decrease that inflammatory load on the patient. So yeah, there are a bunch of different conditions. Autism is certainly one of them that by the genetic lineup that gets your autism turned on. You can also affect the cerebellum, for one thing. The gluten ataxia is very common in people with autism.
Great. If someone, I think we're going to try to wrap this up a little bit now, because I want to give you a chance to. One of the last things I want to ask you is, so if somebody is having, you work with people with nutrition and things along those lines. So what type of services do you have available to those who are listening that, might have a gluten sensitivity or are having some of the issues we talked about, even the musculoskeletal issues that we talked about?
So my goal is always to get to the root of the problem, to figure out why a person doesn't feel well, why are they not healthy, whatever those symptoms are, and they can be very varied. Going back to looking at all of those things, from blood testing to lifestyle to physical exam. We collect all of that information and then create a plan. And sometimes that plan is chiropractic treatment. Sometimes it's exercise. Sometimes it's nutrition. Sometimes it's everything. And sometimes it's coaching for their lifestyle and things that they need to do. But those pain symptoms, those GI symptoms, those are symptoms. So my goal is always to get to the cause of the problem. What is the root and how can we affect it? If it's something like celiac, obviously we can't get rid of celiac, but we can create a lifestyle that supports that patient so that they are healthy and vibrant and not causing any long-term damage to their GI tract. And for some people, we can heal that gut. We can look at what it is the cause is, and we can go through and heal it so that we can reintroduce gluten. I've had lots of patients where we, spend some time healing and investigating. And once that healing happens, we reintroduce those foods and they're able to tolerate them.
Oh, so that's wonderful.
There really are a lot of options, but for me, it's getting to that mystery. Like, what is the very base of what's happening? Because oftentimes one thing just rolls into another. And, by the time they get to me, sometimes they have so many symptoms, they can't remember how it started.
Right.
So,
and they also might be on so many different drugs, and the drugs are, one drug's causing, they're taking this and then it's not this side effect.
For, prescription medications and over-the-counter medications to have nutrient depletions. So certain medications cause nutrients to be depleted, and the nutrient depletion is the side effect. And so, you have people who are like, oh, well, I take this and I deal with this side effect because I have to take this medicine. Well, the truth is that in many, many cases, if we deal with the nutrient depletion, that side effect goes away. And so now you don't have those long-term side effects from that medication that you absolutely have to have for your heart or whatever it is. I'm not a clinician who's going to tell you not to take your heart medicine.
Right.
But I'm going to tell you how to take it so that it does the least damage to your body so that you get the maximum benefit from it long term, if that's what it takes. So yeah, just really looking at every aspect of what people are putting into their bodies and how are they sleeping and how do they spend their free time, and everything plays a factor.
Yeah. Well, and how would someone find you, set up an appointment, any of those things?
Well, I don't advertise. So you have to go to my website, which is Dr. Viola Can Help. So Dr. and then my first name, Viola, CANHELP, at gmail.com would be email address that you can email me, or at just.com would be the website address. So either one of those is a perfect way to get in touch with me. You can call if you want. There is a phone number, but the truth is email or website are the best ways to get in touch with me and communicate. And we set up a consultation. We talk for a while and try to create a plan.
That's awesome. Well, I know you've helped myself and my family in so many different ways, and we appreciate you. And, we really just touched on a little bit on this topic. There's so many more things we could talk about, like, where do you find gluten? Because it's not all just it's not just a wheat products. There's so much more we can go into. If any of our listeners have any suggestions on more things that they would like to know on this topic, please drop a comment below, and we would love to hear what you would like to learn about this particular topic or any other topic that Dr. Viola could talk to us about, or anything else we might want to discuss on the podcast. Our podcast is sponsored by my business, which is Your Journey to a Better You. And I am a what I like to call a life transformation guide. I help others figure out what's not quite right in their lives. And we look for patterns, behaviors, trapped emotions that are keeping them from moving forward in the way that they really want to move forward. I also teach classes, and I actually have a couple classes coming up at the Energy Connection in Irwin this coming month. I have, and this is June 2026 for those who are listening past June. On June 19th, I'll be offering a summer solstice crystal grid class. We will be, it'll be a nice hands-on activity. We'll be creating crystal grids to set our intention for what we want to bring into our lives over the next 3 months between now and the fall equinox. The other thing that we'll be doing is on June 26th, I will be offering an intro to emotional freedom technique. That is a technique that has been used to help people with PTSD and all kinds of other challenges, but it helps break behaviors. It helps you change the way you think about things, break old patterns, and it kind of involves tapping on different acupressure points. And some people refer to it as tapping, or have heard of it called tapping. That class is going to be on June 26th, and then starting in July, on the second Wednesday of July, and moving forward, hopefully the second Wednesday of every month, is when we're going to have a weight loss healing circle where we'll be using EFT to help people figure out, like, a lot of us have the same challenges, right? Like, it's, we don't choose healthy foods, or we don't like to exercise, or we, can't stop putting the foam in the cold brew. A friend of mine said to me today, she's like, I know I shouldn't do it, but I still do it. But there's lots of things. We stress eat. We, different things like that keep us from living the healthy life we want to live. And what we'll be doing is we'll be working as a group to help change those patterns. And initially, probably the first one is going to be in person, but after that, we'll be offering them both in person and a hybrid. So if you live anywhere else in the country and you want to participate, you can. If you're local and you want to come in person, or if you're local and you want to do it from the privacy of your home, you can do that too. But for any of the classes that I offer, or that will be held at the new center that I'm going to be opening come September 1st, check out my website. It's yourjourneytoabetteryou.com. Thank you all for listening. Thank you, Viola, for coming and sharing your expertise with it.
My pleasure, Linda. Anytime.
And I really appreciate you. I really do. So thank you all.
Thank you for tuning into this episode of Your Body, Mind, and Spirit. For information about upcoming guests or transcripts of this and other episodes, visit yourbodymindandspirit.com. The content presented on Your Body, Mind, and Spirit, including interviews, opinions, experiences, and information shared by guests and hosts, is intended solely for educational and informational purposes. It is not intended to diagnose, treat, cure, or prevent any disease or condition, nor should it be considered a substitute for professional medical, psychological, legal, financial, or other professional advice. The views expressed by guests are their own and do not necessarily reflect those of the host or producers. Listeners should consult with their physician or other qualified professionals regarding any specific concerns or before making changes to their health, wellness, diet, treatment, or lifestyle practices.